All right, so thank you, everybody. So for those in the audience, this is a last-minute change we made just about 5 minutes ago. So bear with us, and thank you very much. Thank you for passing on the duties of moderator. So these are the questions that they worked on, but I know she has amazing answers for them, so excited to hear her responses. And with that, we'll get started. So I think the best way to start would have everybody introduce themselves. I would love to hear a little bit about what your roles are and your experience and how you guys imagine the future of benefits.
So Pete Bergamo, Executive Director of Strategy and Execution at Sutter Health Plus. My background is in audit and then consulting, both in financial services and then in the healthcare space on the payer side. I then was at UCLA Health for a few years in their affiliations and partnerships group. And then have transitioned to Sutter and moved to NorCal in 2016. I was in the system office and then now work at our small but growing HMO health insurance plan. So Sutter Health Plus has about $500 million in revenue, 88,000 lives. It's the second fastest growing commercial plan in Northern California since 2014, since ACA. And we've doubled in revenue the last 2 years and been able to hold our own administrative expenses flat. So something to be proud of, and look forward to speaking with all you.
As a Palo Alto native, Sutter Health has been my plan for the last 15 years, so it's close to home on many fronts. Kalina, thank you for stepping in on the panel side. Would you like to introduce yourselves?
No problem. I'm jumping in to answer now. So I'm Kalina. Nice to meet you guys. I work for Sequoia Consulting Group. So for those of you that aren't familiar with us, we're a benefits brokerage and HR consulting firm based out of San Mateo with offices in New York and in San Francisco. So my role is well-being director for our clients, which basically means that I help with any benefits that support the well-being of people's employees. So I've been working there for almost 5 years. It's been a very interesting ride. We started out with some small clients and now manage benefits of some clients like Fitbit, Snap, Uber, Netflix. So it's been really, really interesting to look at how the definition of benefits has evolved and what that means to both the company and to employees. So I spend part of my time consulting and then part of my time also evaluating different vendors and tools like many of you in the room. So yeah, excited to talk about this.
Thank you.
Balaji Bondali, I've been with Deloitte for a long time, and in the last about 5 years, got out of consulting to figure out what is the next generation of work look like. How does the triage between full-time employees, gig workers, freelancers, crowdsourcing companies look like, and also the new capabilities of digital FTEs, which are the bots. So when work comes in today, it pretty much goes to a full-time employee or sometimes some contingent work. But in the future, as in the last panel was discussed, a lot of it will start going to freelancing, gig economy, contingent workers. So not only do we have proliferation of benefits, we have now proliferation of roles. So now if you stack that two grids together, it's chaos out there. So my role is to just figure out that landscape and help our clients think about how to structure their future of work more from a work perspective, and then talent comes next.
So thank you guys very much. Okay, so for our first question, we're kind of set the tone. So how do you guys see work today as it stands? And what are some of the biggest changes and surprises you've seen and how this is evolving in the near and distant future? Kalina, you can start.
Sure. So it's definitely interesting. I mean, I will give the caveat that most of my answers are going to relate to how work has been evolving in the kind of VC-backed tech company space. So I mostly work with clients under 10,000 folks. But it's been really interesting to kind of see how, to me, the future of work, when we were kind of talking about that question, is just really thinking about the future of life. So all the things that you see outside of the workplace that have really transformed the way people live. So whether it's the shopping through Amazon, transportation through Uber, a lot of those tactics that have been so successful are what companies are taking into the workplace because people have the same frustrations. Like, why do I have to have, 10 different passwords for this? Or why is this process so slow? Or why can I not get access to care as easy as I want to? So I think employees are really challenging employers to deliver the right systems, the right structures, the right support, the right benefits, because they expect things to be high tech, to be easier, to be quick, to respond to their individual needs. And so I think a lot of that has played into kind of the future of how people think about all of these different programs within their company, is they're taking a lot of the aspects of what's working in the kind of like direct-to-consumer commerce world and really trying to apply that into the business setting. Does that make sense?
Balaji, same question to you.
Sure. I mean, if you look at large companies, right? I mean, and the reason why they exist is they are pretty much the aggregators of capital, supply, demand, risk, talent. And if you see what Silicon Valley has done or technology has done, is it's pretty much it's starting to break up that large company. The supply has been disintermediated, demand is breaking up, the risk is breaking up. But the only thing that is holding large companies together is talent. That's the one space that has not changed for the last 100 years. It's exactly the same with some smattering of contingent workforce here and there. There's very little, everybody who joins a new company hates onboarding. The loyalty to large companies is going down. And as such, that is the reason you see all of these new freelancing, gig economy options coming up, where even if you can get a job at Facebook or Google, but you still have to have roommates because you just don't make enough money. So the concept of large company employment it's unraveling in many cases, and I think large companies still are struggling to find their voice that work is changing, workforce is changing, and how do we then incorporate fundamentally these new ways of working into the mix? And as such, as you see a lot of discomfort in large companies now, when you think about how do I pixelate work into smaller bits so that I can actually distribute it to people around the world who are actually passionate about it, versus putting an employee into a box and saying you're going to optimize within that box for the rest of your life without thinking about what else that person could be doing. You have now bots coming in where you have all of the automated activities or automatable activities going away, but companies are not thinking about the future of work in a way that is technology driven, that is in keeping in pace with workers' demands and needs, as Kellen also said.
So perfect segue to Sutter Health, 60,000 employees, and Sutter Health Plus, we call ourselves the sub of a sub. We're about 100 employees within the broader 60,000. I look at it as a lot of meetings and missed opportunities. I think that's been our theme right now is really just trying to work with our workforce to understand that people want to be engaged, and how do you turn that on for people? How do you bring someone into a conversation, get a diversity of thought? So I think that's something that we're seeing as an opportunity. I think the future for us is looking at digitalization. I don't think I can speak probably as to the expertise that all of you can, but we're trying to think about how to leverage that, how to use that to, again, engage our workforce. I think the way we think about it in the future is we want balcony thinking, and we want it practical. We'd like for everyone in the workforce to be empowered and to be able to make decisions, because as systems start to collapse, as the speaker spoke earlier about how things are blurring, I think having an understanding of the whole company's workflow and how your decisions have unintended consequences on others is something that we're seeing is probably in the next 3 to 5 years for our company.
That's great. So obviously the employees are demanding very, very different solutions from their employers. There was an example I liked recently I saw a couple of years ago where one of the Palo Alto medical foundations, it may have been PAMP itself, had developed a mobile unit that was specifically for driving out to people who are in hard to reach areas and getting them hospital care. Not a very profitable business model, very difficult to execute. And what they actually found where the product market fit was just driving this bus down the road to Google and Facebook and Apple, and finally getting those engineers basic care because they weren't even leaving their offices. And so these are the kinds of examples where we're seeing very different types of benefits being brought into these major companies because access to talent has gotten so difficult. And so health being a major component to that. how have you seen the demands of the employees shifting, and what is Sutter Health doing to kind of work towards that?
I think one of the big things is employees want comfort, but also realize that change is coming and that they need to be at the forefront of change. So I think there's that constant dynamic of trying to be supportive, but also be progressive and push them. What we talk about is a little bit about innovation leads to differentiation. I think because there are so many startups out there, we tend to look at it much like the auto industry maybe around 1900. There's a lot of people tinkering. There's a lot of new innovations going on. If you're able to partner and leverage some of that technology, right away you're going to be a little bit different. You're going to grow up. You're going to work with people differently. So I think the way we look at it is managing that against risk. And so I'll be on the one side as strategy, and then I'll have our CFO kind of rein me back in and make sure the numbers work. But I do think that as we look at social determinants, as we look at simplifying things such as that, we do see that as you take more risk on as a provider, and again, it's a little slow, it's a little more progressive in California than the rest of the country, it does make sense. It does make business sense. And so I think that's the challenge before us at Sutter Health is, again, we've grown up as a hospital-dominated organization, and it's really thinking about where you make those smart investments and then continue to look at the return on that investment.
Yeah, sure, I can add quickly. I think to go back to the employee demand side, it's definitely a hard thing that we see with a lot of employers in terms of how do you choose between a lot of benefits. That's really where a lot of what I do and my team does at Sequoia comes in and tries to help with that. And I think I'll give an example, but so we do a lot of surveys with our clients to help them evaluate what benefits that they want to do. And surveys is a controversial topic, of course, with a lot of clients because some want to do it and get the feedback, others worry about providing it and then they won't be able to deliver and all sorts of things like that. But you do have a lot of employees that will indicate in the survey that they want different things. And then it comes up to the employer where oftentimes they'll come to us and say, hey, we have $100,000, $50,000 to spend on one benefit. What do you think we should choose between student loan repayment and fertility? And for anyone in the room, you can probably understand, that's a really hard thing. Those are apples to oranges when it comes to who it's going to cater toward, who it's going to support. So I think a lot of where HR leaders and benefit providers and things are struggling is that they're trying to figure out how do we cater towards such a different audience when a lot of these vendors have their models in a way that you have to, like a PPM, pay for the whole population. So I think we're seeing a lot of pushback and debate from HR leaders and, for any of you guys that are providing services in this room is, how do we kind of help solve for that and view that challenge, because people are really trying to get to the point almost where employees have like a budget or a fund where they can choose what's important to them is a big kind of ask we see of our HR leaders. And so trying to figure out how we can, have partnerships between vendors or different things where employees can really be able to choose what's important to them, and it's not so heavy on the employer to decide on behalf of the employees whether student loan repayment or fertility is more important to them. And so that's a big thing in response to employee demands that we're seeing is, we're really trying to push vendors to help solve for how do we not make it so an employer does have to just choose between two, but rather they can offer a suite of benefits with their budget that helps cater toward multiple needs.
Balaji, we'd love to hear, are there any outlying, demands that the employees are asking for, or specific types of things that are new that were unexpected?
Yeah, and I think there's an issue with the premise of the question, right? I mean, if it's not as though people in tech don't have time. If you are in San Francisco and if you walk around in the lunchtime, you will see 100 people standing outside a Filipino truck for food. So it's not as though they don't want to go get healthcare and they don't have the time to do it. It's just that they don't think it's important, because the benefits that are being offered right now are not the things that they think are important to them. And it's all of my friends or people who work in tech that keep themselves fit by biking or going to the gym or working out or yoga. Insurance is not a part of that situation at all. Insurance comes in general, comes in when something bad happens, then insurance is there to protect me. The other times are I'm going to get my annual checkup done. So there's clearly a huge disconnect between where people are, what they want, what they consider health, what they consider wellness, whereas where insurance is. I'm not an HR benefits person. I'm just purely from a employee and a simple employee perspective, and having all of these new people join my team, and I have asked them that question, what do you think about insurance? They typically say it's like a tax. I have no clue where the money goes because I'm not using it. I go maybe once in a year to a health checkup. That's all there is. I think employers have to really think about what are the priorities of the employees and what do they define as health, what do they define as wellness, and as such, structure programs around that, versus right now, I think the difference is very far off.
That's something we hear a lot, kind of like what are their expectations or what are their definitions of like health or benefits, right? There's, I remember a survey recently or a couple of years ago, they asked different generations how they defined healthy. And millennials defined it as working out, eating healthy, proactive health, versus the generation above them, baby boomers and others, look at it as not sick, right? It's a very different baseline. And kind of creating a suite of products that fit those baselines differs significantly, especially within the culture of an organization. So kind of leading off of that, and Pete, I'd love to hear you on this one first. What are some of the major trends that are happening in our population that our employers should be worried about or thinking about? Is it mental health? Is it nap pods? I mean, what are the basic things that we should be really considering from a population health perspective or just a population activity perspective that needs to be factored into this moving forward?
I mean, I think, again, you'll probably read it every day and hear it. It is mental health. I think, so what we've done is some of the things that we're doing, and on a smaller scale and trying to pilot, is creating more of an omni-channel approach. We have 5,000 physicians, and you typically have the same interaction with our primary care physicians across the network. We've introduced what we call a terror practice that's a virtual first practice where we tend to allow for phone calls, for text messages that aren't typically reimbursed, but again, we're a fully capitated model. I think of mental health for sure. As you get into the aging population, the simple things of home modifications. I'm currently writing a business case right now to do just that, and to think about going in and being able to serve the member in their home, add railings, add elevated toilet seats, very simple things. This is what, JAMA just came out with in internal medicine, that there's studies that are showing that it is saving Medicare money. So I think it is just that. I think it's figuring out what it's going to get more personalized. It's going to be more individual. And I think the challenge is, historically, the health industry has been around consolidation and conformity, and we're going to need to begin to build more personas, understand what the consumers want and value. To your point around younger generation, thinking about how you layer on gym memberships, how CrossFit, doing partnerships that way. We've been exploring because there is that two-by-click with one with HR and then with the employee is how we're seeing it. So. I think you're seeing that across the national policy scene. I think it is a lot of talk. It's more to come on seeing this come out in the next few years. But it is changing the discussion around meeting the people where they want to be met. We've just created walk-in care clinics as well, low acuity. When we looked at the numbers, 80% of office visits could be done at a walk-in care, and 80% of those could be virtual. So 64% of what's in an office today could be done, through a virtual visit. And those are the things that we see as potentially, some of the cost crashes that we hope to see in healthcare in the future.
Kalina?
Yeah, I can add on to that too. I think something that came into my mind when you were talking about like walk-in clinics and all of that stuff too is just kind of the transparency and how benefits are communicated to employees. I know that communication has come up a lot, but back to the survey point, we did a survey with a few clients and we used to ask, most HR people are inclined to ask, how do you feel about this benefit, 1 to 5, whatnot. And sometimes they don't dig enough deeper. And so we this year did a survey with a client where we asked them to rank the benefit, and then the employee had to also indicate how many times they used that benefit. And it was really interesting because you might have someone that ranks the benefit a 1, and then you ask how many times they used it, and it was 1 time, and they had a bad experience, or 0 times, and it just doesn't seem to be the benefit they want. So I think there's a lot of need for like communication and different things like that too. The other is just when it comes to like the insurance piece itself, and I can go into some of the other topics that we get, but is also just that concept of cost transparency and really not understanding what the total will be. Again, to kind of go into that concept of the future of work is the future of life. Some of you guys may have gone to websites when you do online shopping or things, and there's like a mystery item where you have to add it to your cart in order to buy it or things like that. And people, I think, hate that because they're like, just tell me how much it is. I don't want to add it to my cart if I'm not aware of how much it costs. And it's kind of the same thing. A lot of people, when they go use their insurance, it's kind of a rolling the dice. Like you have a earache or you're really sick or get injured on the weekend and you go into urgent care and you're not totally sure what it's going to end up being. And so people are actually scared to use their insurance because they just know what the total outcome will be. That said, to your point kind of about a lot of things living outside of insurance and making time for things that they want to do, we see that a lot with our clients and their employees. Is no one actually really is walking around these days and asking their friends or colleagues like, hey, who is your primary care provider? They want to know, who is your acupuncturist? Who do you go to for chiropractic? Who's your nutritionist? Who do you go to for holistic medicine? Who helps you out with your fertility? So there's this whole huge need also to kind of target those other areas with benefits, and really it's anything going on in people's lives. So we break our benefits down into 4 categories. It's kind of this physical health and nutrition, emotional health and behavioral health, financial health and awareness, and then family-focused benefits, which is not just childcare and family forming from the standpoint of that, but also taking care of elderly parents and folks at home for those that are kind of in the middle of that generation. So we think about all those things across the spectrum, and then just really, kind of how you go about targeting those, but also communicating the things that you do have and helping people understand how to use them.
Did you want to answer or jump into the next one?
And it's as an employee, and I'm going to be the employee representative on this panel. We don't think about them as benefits. And when we actually did a project recently, and two interesting stories came about. One is this person said, my insurer should know that I ski every year because in the last 10 years I've broken something 8 of those 10 years. But I don't get any predictive messages saying ski season is coming. You either fix your gear or go get more lessons, do something, because this is incredible cost that we're incurring because of the ski season. But this is not a benefits conversation. This is a preemptive conversation based on the data that you already have, and that rarely happens. The second conversation is parents. A few months back, there was, and this is a physician friend of mine who was talking to me. A few months back in San Francisco, there were all these forest fires and smoke coming into the city, and he saw the number of parents coming into physicians' offices saying, "Is my daughter okay? Is my son okay? Is an infant?" And we went for a walk, and he's coughing. There is no information coming in from any of the insurers. Of course, the insurer is paying for all of those doctor visits. But there's no information coming from an insurer saying, we know this is happening in your city or in your area. These are the things that you should be concerned about. If these are the symptoms that you see, you're fine. There is just no communication that comes in from an insurer that preempts a potential visit, that too at a large scale, at a pattern level versus an individual level. And I think all of these fit within the existing benefits. The conversation is not always about what else to add. It's just poor utilization, poor communication, poor management of the existing benefits, I don't get any emails from my insurer, period. And there is no way that my insurer knows what I'm doing, can predict so much things, because they have all of my data. And that too, after I've had a baby, they have a lot more data about my family. But there's very little communication that comes in because they're just not thinking about it in terms of, can I prevent something using the data? Which is I think where the significant bending of the cost curve will happen as we are thinking about adding all of these new use cases and new benefits to insurers, to employers. There has to be a different way in managing the cost.
So hold on to the mic. My next question is kind of examples. One that I like, my roommate Very sharp guy would do massive Workday integrations. I worked for a company called Aperio. Aperio had hundreds of employees and that, but their CEO fundamentally hated the idea of office space and offices, right? So, hundreds of employees, decentralized. It's a relatively young company doing very modern integrations, and they would send thousands of dollars to their employees to build very in-depth in-home workstations. And as a result, they saved tons of money on resources, and the company was soon acquired for $500 million for a fundamentally different way of working in life. So curious from you guys, have you seen any interesting examples in the companies today providing unique benefit packages or unique work environments or just employee engagement strategies?
Perio did a little more than that. They actually also bought a company called Topcoder, which is a crowdsourcing competitive company. And one of the big reasons why Wipro bought them is because they have access to this million strong designer, developer, data science talent base that is across the world, that is working from wherever they are. If people are making enough money, they don't need to be given a computer. They'll find a computer that they need. I think the whole conversation about gig economy, freelancing, and crowdsourcing is moving towards individual agency where I make the choice of what I want, the type of work that I want to do, and I will invest against it as long as I'm getting paid for it. But the problem that happens for these types of individuals is the insurance benefits are often, there are new companies that are coming up to solve that problem, but they don't exist that much. And employers are asking themselves now that question, saying, these people are cheaper, and are they cheaper primarily because I'm not paying them their benefits? And is that a fair, am I comfortable with that situation that my cost benefit is primarily a result of lower benefits? And as such, you see a lot more companies coming up with mandating either maternity benefits or health and wellness benefits to these contractors as well. These are not new benefits. These are just existing benefits that just need to be better assigned to the right types of people.
Any examples of companies you've seen that you guys maybe have worked with or for that have had pretty interesting concepts here?
Yeah. I'm under some pretty tight NDAs, so I won't say the names of these companies, but I'll give two examples. So one is we have a client who is always kind of experimenting with benefits. I think one thing that a lot of vendors don't do as much, some are pretty good about it, is like trying these little pilots with companies and being willing to listen and give feedback. And I have one company that's done a really amazing job of building these internal kind of focus groups or employee resource groups that are specifically focused on like mental health and parenting. And if you ask your employee group, there's always people that are willing to be like, yeah, I'd love to be part of the mental health review committee, or I'd love to be part of the parenting committee. Like, I am one of those people. And so these people have no experience in benefits, and they're not in the benefits team. But when they're thinking of introducing a benefit, they essentially do like what you guys are here to do, but present an idea and let those employees give that feedback. And it seems so simple, but I think a lot of companies don't do that enough, where they're actually picking a team of experts on a particular topic just based on the fact that those are the people who need that benefit and getting their particular feedback. So an example would be, that client was reviewing a student loan vendor and a vendor that was going to help with family care and management and things like that. And after doing the two focus groups, they kind of were like, the student loan repayment, they came up with a method that they were going to do that was a little bit different and a little bit more focused on just education and some on-site workshops about debt management. The parenting group absolutely loved it. They gave some feedback back and forth, and so we're trying out that benefit. So that's something I think is really important. And then the other thing I'll add, my second example would be that this might sound a little bit on the softer side, but it really is about making sure whatever benefits and things you're doing actually align with the culture and values. And like I said, it sounds a little touchy, but it's so true, because I have clients that will roll out a mental health benefit thinking it will be the solution for their really burnt out population, and just be like, hey, you guys take a 15-minute break or try to work less. And these people just sit there and are really annoyed because they're like, you're really telling us to work less in the middle of this push? Like, I don't buy it. And so we really have been doing a better job, I think, at working with the HR folks, the vendor themselves, and kind of pulling in the CEO or leadership to be like, can you actually promise that this is something that you're going to find a way to change a little bit? Otherwise, there's no point in spending all this money on this benefit. Same thing with parental leave policies. Same thing with financial wellness. You need to think about all of the structure and how you're actually asking employees and from a workload perspective or from a time off perspective or different things like that, and make sure that that's part of the rollout of that benefit, or it's just going to completely fall flat.
I'll take a different approach. It's how you engage. And so what we see in healthcare, a lot of the innovative ones are actually out of more of the Medi-Cal space, Medicaid space, as well as ones that are taking full risk and are smaller companies, are disruptors, are able to move up market as opposed to being a big company like Sutter that's trying to make some changes. So we see them, there's a few back east, ChenMed in the southeast, City Block, I believe, is the Medicaid one in New York City right now. Iora Health is one in Massachusetts. And I'm blanking on the one in Chicago that we really based some of our work around at the moment. But really, again, engaging people where they want to be met. I can't say that enough. It's around simplification. In some cases, we talk a lot around navigation as well. These companies do it really well. There's a lot of regulation around how you introduce benefits to a person when they first come in, but there are so many digital touch points and pushes you can do, light touches such as, hey, it's ski season. So we talk about that a lot. It really needs to occur. It probably needs to occur faster, but it is that relationship. There are companies that are showing us that. We have a pilot with a company called Docent that when you get pregnant, you get a maternity app, and it follows you through, and we call them kind of a Sherpa. This person is a digital bot. Sometimes it is a person on the other end that's interacting with you. What was interesting with the pilot is sometimes when the person was in the delivery room, you'd get a text to the docent saying, you know, I really didn't like that nurse who came in just now. It made me feel uncomfortable. This person's about to give birth. And so the docent's able to then hit the nurse station and say, hey, you know, please, you know, maybe we go in with more of a smile. So it's really those touches around the edges. We see healthcare, no matter how many billboards or things you see around, it is really personal. It's communicated. Bad experiences are amplified as opposed to good experiences. So I think you guys are spot on with your observations.
Absolutely. So it takes more than a pizza party to keep your engineers, huh? Well, I'm very glad to hear that, and that's awesome insights from everybody on the stage. So I'd love to get a quick thank you from the audience for everybody that participated. And kind of keeping in the theme of the event today, you know, we really think that, you know, one of the major themes for insurance in general is that it has to be more service-oriented, it has to be more engaging, it has to be more personalized, and, you know, really connecting, you know, the employees and the employers and the group benefits providers and all of that really is that perfect environment where insurance companies can play a more active role servicing people, making lives healthier, making them happier, you know, making them more successful. And, you know, this is very much a channel that we're excited to see a lot more development in. So thank you for everybody, and we'll get next to our next startup. So thank you.
Thanks.